stroke occurs when the blood supply to the brain is blocked or reduced. That can happen because of either a blood clot that breaks off and goes to the brain, or sometimes there's a narrowing in one of the arteries that supply blood to the brain. In some cases, bleeding in the brain also causes it, but anything where you interrupt the blood supply to the brain can cause a stroke, and a stroke basically means that some of the brain tissue dies. I'd be curious to know what you say to your patients.
Two main types of stroke. One is where a clot has produced a stroke in the brain called an ischemic stroke, in which parts of the brain lose their oxygen and blood supply. The other type of stroke is called a hemorrhage, in which there is bleeding into the brain. There's different types of hemorrhagic strokes. One type is called an intracerebral hemorrhage, in which there's blood in the actual brain tissue. The other type is called a subarachnoid hemorrhage, which is typically caused by either trauma or a cerebral aneurysm. There are a couple different types of ischemic stroke. One is called an embolic stroke, and where there may be a clot coming from the heart or another part of the artery to the brain. Another one is called a thrombotic stroke, when there is plaque and clot formation within the arteries of the brain. Strokes can be caused by a couple different things. It can be caused by cardiac abnormalities, either an abnormal rhythm of the heart, such as atrial fibrillation, or other structural abnormalities of the heart that predispose the heart to develop clots that could travel to the brain. There can be damage to the blood vessels of the head and the neck, plaque formation caused by atherosclerosis that can cause strokes. Sometimes, less commonly, there are other genetic conditions that can predispose the patient to have a stroke, either by abnormal formation of blood vessels or a clotting disorder.
It's very important to identify a stroke quickly because the longer the brain is without oxygen, the higher the chance of permanent damage. We ask people to remember FAST, F-A-S-T, to spring into action. F stands for face. Is there anything abnormal about the patient's face? Is there smile drooping? Is there eyelid drooping? A stands for arms. Ask the person to raise their arms and observe if one of the arms is drooping. S stands for speech. Listen to the speech carefully. Are they slurring their words? Ask them to repeat a very simple phrase. The grass is green. If they cannot repeat that phrase, the higher chance of stroke. And then T, if you see any of these things, time is of the essence. Call 911 right away.
Recently developed treatment is called TPA, or tissue plasminogen activator. People who have strokes, if they are due to the evolution of a clot within a vessel or from a piece of thrombus that comes from the heart, can be treated provided there's no bleeding into the brain and provided their blood pressure is not too high, and provided we get to them within 3 hours, can be treated with this clot-busting drug called tissue plasminogen activator.
This is the main artery to the brain. Smoking makes fatty deposits stick to its walls. If they stop blood flow to your brain, or if a piece breaks off, it can cause a stroke that can kill, blind, or paralyze. Not all smokers have strokes, but all smokers do have fatty deposits in their arteries that can cause a stroke at any time.
Some strokes are deadly or disabling, but here's the thing. You can do a lot to lower your chances of getting one. Maybe you've heard how important it is to lower high blood pressure. Well, that's true, but don't stop there. Get enough exercise. Work up to 30 minutes of heart-pumping activity at least 5 days a week. Eat healthy too. Cut back on red meat and enjoy plenty of fruits and vegetables. If you're overweight, aim to lose 10 pounds to start. And if you smoke, set a goal to quit. What else can you do? Control your cholesterol levels and take charge of your stress. If you drink alcohol, do it in moderation. And if you have atrial fibrillation or diabetes, follow your treatment plan to keep it in check. For WebMD, I'm Dr. Michael Smith.
A stroke is very serious and needs to be treated right away. You'll commonly see this in elderly people, but you can see it in all ages, in all walks of life. You want to diagnose it quickly and you want to get help quickly. So what is a stroke? A stroke is a stoppage of blood to the brain. It can either be through an obstruction, which is like a blood clot in the brain, or it can be through hemorrhaging. Something is bleeding out and you're not getting enough blood to the brain. So what will you see? You'll see numbness, you'll see tingling, you'll see vision disturbances, you'll see trouble speaking, trouble understanding speech, trouble walking, dizziness, confusion. Sometimes you'll see a sudden severe headache that comes out of nowhere. So what are some of the signs that a person displays? Here's what you can do. You can have the person smile. You can have the person stick out their tongue. You can have the person raise their arms, and you can have the person speak to you. With a stroke, you're going to see one side crooked. Their tongue will be crooked, their smile will be crooked. Sometimes they can't even raise one side of their face. They'll have trouble walking and maintaining balance. You want to get help right away. The faster you get medication, the faster you get treatment, the better the outcome of a stroke is. Call 911. Tell them, I think my friend, I think my family member, I think someone's having a stroke. With a stroke, every minute counts. Every minute that you're in the house, every minute that you're in transit to the hospital, and every minute from when you get to the hospital to when you get to the stroke unit. The faster you can get them treatment, the better their recovery will be.
There is yet another reason to talk to your doctor about lowering blood pressure to lower your risk for stroke, and also doing something to calm anxiety, according to this new report. We stopped out at Bethesda Family Medicine to tell you a little bit more about this research. They are a practice of TriHealth, and researchers say doing something like yoga might make a difference in bringing down anxiety, fear, things that they now have discovered can influence your cardiovascular system even years later. Researchers followed about 6,000 adults for 22 years, found those who didn't do this type of activity had the highest levels of anxiety, and they were 33% more likely to have a stroke than those who had the lowest levels. Now, the authors of the study also found that the people who had a stroke were less likely to exercise. So it could be that it's partly the yoga and partly the things that bring down the stress, but it's partly just any activity that might also make a difference in reducing stroke. Again, it's blood pressure, it's activity levels, it's weight, it's salt intake, it's a number of things that can influence this. But if you're doing all that and not paying attention to these stress levels, researchers found it could make a big difference, not right away, but maybe later, in upping the odds of having a stroke. That is our Health Alert in Norwood. Liz Bonus, Local 12 News.
So I developed an exercise program in the community to try to address the specific needs of stroke survivors so that they could have a place to come out and exercise at their level and continue on with their recovery, because we know that stroke recovery can go on for years as long as people are provided with the right opportunity to exercise at their level. So the class expanded, more and more people were coming, more and more levels were taking part and benefiting from the class, but I began getting a lot of requests from people out of town, or maybe people who couldn't get out during the winter. So we came up with the idea of having an exercise DVD. So we've designed a series of exercises with a starter, an everyday, and an advanced series of exercises. So there's a level of exercises that is appropriate for everyone, so that people could then exercise in their home, continue to get the benefits from the community-based program. So that the exercise DVD was designed basically off of the community-based program, which has already proven to be successful. But people can then have that option of exercising on their own at home, and not only can they exercise in their own home, but they can do it more frequently. So they can do it on their own schedule. They don't have to be at a certain place at a certain time. They can now exercise on their own schedule, at their own level, and it becomes a much more convenient and personal-based exercise program.